Are cramps a warning sign of something serious? Find out now. Cramps are a common occurrence, but have you ever wondered if they could be a sign of a more serious health issue? Many people dismiss muscle cramps as a normal reaction after physical activity or an uncomfortable sleeping position. However, if you experience frequent cramps without a clear cause, especially at night, it could be an important warning your body is trying to send you. There are many possible causes of cramps: electrolyte imbalances, dehydration, poor circulation, or even side effects of medications. But what most people don't realize is that cramps can also be linked to serious medical conditions, such as neurological disorders, vascular diseases, or even early signs of chronic illnesses. Don't ignore the signals your body is giving you. Stay with us until the end. There's one dangerous condition that many people overlook, but understanding it could help you prevent serious complications in the future. PAD cause number 1, peripheral artery disease, PAD. Cramps could be your body's early warning sign. Cramps can strike unexpectedly, but if they occur frequently, especially during physical activity, they may be an early warning sign of peripheral artery disease, PAD. This condition occurs when arteries become narrowed or blocked due to plaque buildup, mainly cholesterol and fat, reducing blood flow to the lower limbs. When muscles don't receive enough oxygen and essential nutrients, they can spasm, leading to painful cramps. One key characteristic of PAD-related cramps is that they often occur when walking, climbing stairs, or standing for long periods, and tend to ease when you stop to rest. This is known as claudication, a hallmark symptom of PAD. Who is at risk for peripheral artery disease? While anyone can develop PE, some groups are at a higher risk, including smokers. Nicotine constricts blood vessels and contributes to plaque buildup in the arteries. People with diabetes. High blood sugar can damage blood vessels, leading to atherosclerosis. Individuals with high blood pressure or high cholesterol. These factors accelerate arterial hardening, reducing blood flow to the legs. People over 50. The risk of PAD increases with age. If you frequently experience cold feet, numbness, slow healing wounds, or changes in skin color, these could be advanced signs of PAD, and you should consult a doctor immediately. Solutions to improve blood circulation and reduce cramps. Increase physical activity. Light walking is one of the most effective ways to improve blood circulation. As you walk, your muscles apply pressure to help push blood through the arteries, enhancing overall blood flow. If you experience leg pain while walking, don't stop immediately. Instead, slow down and allow your body to adjust. Regular exercise can gradually improve circulation and reduce discomfort. A heart-healthy diet for artery protection. Limit foods high in bad cholesterol (LDL), such as fried foods, processed snacks, and red meat, as they increase the risk of arterial plaque buildup. Increase your intake of omega-3 rich foods, such as flax seeds and walnuts, to support heart health. Incorporate foods rich in magnesium, potassium, and calcium to help muscles function smoothly and reduce the risk of cramps. Quit smoking immediately. Quitting smoking not only improves blood circulation, but also significantly reduces the risk of heart disease, stroke, and peripheral artery disease, PAP. See a doctor if you have severe symptoms. If you experience frequent cramps, leg pain while walking, cold feet, or slow healing wounds, consult a cardiovascular or vascular specialist. In severe cases, PAD may require advanced treatments such as vasodilator medications, stent placement, or vascular surgery. Cramps may sometimes be harmless, but they can also indicate a more serious health condition. Don't ignore your body's warning signs. Take proactive steps to protect your vascular health today. Cause number 2, anemia. When muscles starve for oxygen and signal through cramps. Cramps aren't always just about muscles or circulation. Sometimes the underlying cause is anemia, particularly iron deficiency. Iron plays a crucial role in transporting oxygen to muscles through hemoglobin in red blood cells. When the body lacks iron, the oxygen supply to the muscles decreases, making them more prone to spasms and frequent cramps. A key sign of iron deficiency anemia includes persistent fatigue, dizziness, pale skin, and brittle nails. Some people may also experience a rapid heartbeat or shortness of breath, even with light activities. aphthous. If you suffer from cramps along with these symptoms, your body may be experiencing a severe iron deficiency. Who is at risk for iron deficiency anemia? Women of reproductive age. Blood loss from menstruation can lead to iron depletion. People with an unbalanced diet. A poor diet lacking iron-rich foods can cause deficiencies. Individuals with digestive disorders. Conditions like ulcerative colitis or celiac disease can impair iron absorption. Athletes or those engaging in high-intensity training. Their bodies require more iron to produce red blood cells for oxygen transport. If you fall into one of these high-risk groups or frequently experience cramps and fatigue, it's essential to check your blood iron levels and take appropriate action. Solutions to improve anemia and reduce cramps. Smart iron intake from foods. Good sources of iron include dark leafy greens such as spinach and kale, lentils, pumpkin seeds, almonds, and oats. Vitamin C enhances iron absorption, so pair iron-rich foods with oranges, bell peppers, strawberries, or kiwi for maximum benefits. Limit tea and coffee right after meals as they contain tannins that can hinder iron absorption. Consider iron supplements. If your diet does not provide enough iron, consult a doctor about iron supplements. Do not take iron supplements without medical guidance, as excessive iron intake can lead to other health issues. Listen to your body and take action. If cramps frequently occur alongside symptoms of anemia, such as pale skin, fatigue, or dizziness, don't ignore them. Get a comprehensive health check and blood test to assess your condition. Cramps may seem minor, but they can be a warning sign of severe oxygen deficiency. Don't let iron deficiency impact your quality of life. Take action now to protect your health. Cause number 3, peripheral neuropathy, when nerves malfunction and muscles cramp uncontrollably. Cramps are not just a muscle issue. They can also be linked to the nervous system. One of the most concerning causes is peripheral neuropathy, a condition where nerves outside the brain and spinal cord become damaged. This can lead to numbness, tingling, sharp pain, or loss of sensation in the legs, along with uncontrollable muscle spasms, resulting in prolonged cramps. Who is at high risk for peripheral neuropathy? People with diabetes. High blood sugar levels over time can damage nerves, especially in the legs and feet. People with vitamin B12 deficiency. B12 is essential for healthy nerve function. A deficiency can cause nerve damage leading to numbness, muscle weakness, and cramps. Frequent alcohol consumers. Alcohol can harm the nervous system over time and interfere with the absorption of essential nerve-supporting vitamins. Individuals with nerve damage from other conditions, diseases such as kidney failure, hypothyroidism, or autoimmune disorders can also contribute to peripheral nerve damage. If you experience cramps along with numbness, tingling, burning sensations, or loss of feeling in your legs, seek medical attention immediately, as this could be a sign of progressing peripheral neuropathy. Solutions to manage peripheral neuropathy and reduce cramps. Control blood sugar if you have diabetes. Maintaining stable blood sugar levels is the most crucial factor in preventing further nerve damage. Follow a high-fiber diet that is low in sugar and refined carbohydrates to help keep blood sugar levels steady. Regularly monitor your blood sugar and take medications as prescribed by your doctor. Supplement with vitamin B12 to support nerve health. Good plant-based sources of B12 include whole grains, nutritional yeast, legumes, and leafy greens. If you are at risk of B12 deficiency, consult your doctor about taking supplements. Improve blood circulation and support nerve function. Gently massage your legs daily to stimulate blood flow and reduce muscle stiffness. Engage in light exercises such as walking, yoga, or cycling to enhance circulation and keep the nervous system active. Avoid alcohol and smoking, as they can further damage the nerves. See a neurologist if symptoms persist. If cramps are accompanied by numbness, pain, or muscle weakness, don't delay. Seek medical attention immediately. Doctors may recommend nerve function tests or electromyography (EMG) to assess the extent of nerve damage. Cramps aren't just about muscle fatigue. If they're linked to nerve issues, early intervention is key to preventing serious complications. Cause number 4, thyroid disorders. When metabolism goes out of control, leading to cramps. The thyroid may be a small gland, but it plays a crucial role in regulating metabolism, energy balance, and muscle function. When the thyroid underperforms, especially in hypothyroidism, it can trigger a range of problems, including frequent muscle cramps, weakness, and soreness. Why does hypothyroidism cause cramps? When the thyroid fails to produce enough hormones, metabolism slows down, reducing the body's ability to absorb and distribute essential minerals like sodium, potassium, and magnesium. These minerals are critical for muscle contraction and relaxation. As a result, muscles become more sensitive to stimuli, leading to sudden, painful cramps. Additionally, an underactive thyroid of muscles, depriving them of oxygen and nutrients. This explains why many people with hypothyroidism experience cramps along with cold hands and feet, morning stiffness, and prolonged muscle pain. Warning signs of hypothyroidism you may have overlooked. Beyond cramps, if you experience any of the following symptoms, your thyroid may be struggling. Persistent fatigue, even after a full night's sleep. Unexplained weight gain, despite no changes in diet. Dry skin, brittle hair, and weak nails. Unusual cold sensitivity, especially in the hands and feet. A deeper, hoarser voice. Memory issues, forgetfulness, and trouble concentrating. If you notice 2 or more of these signs, don't ignore them. Get your thyroid checked as soon as possible. Solutions to improve thyroid health and reduce cramps. Get your thyroid hormones tested if you notice any irregularities. A TSH, thyroid stimulating hormone, test is the simplest way to determine if your thyroid is functioning properly. If TSH levels are higher than normal, it may indicate hypothyroidism, and you should seek medical advice for appropriate treatment. Incorporate thyroid-supporting foods into your diet. Iodine, essential for thyroid hormone production, found in seaweed, almonds, sunflower seeds, and iodized salt. Selenium helps the thyroid function efficiently. Rich sources include Brazil nuts, mushrooms, and whole grains. Zinc and iron, important for thyroid health, found in pumpkin seeds, green beans, and nutritional yeast. Maintain a healthy lifestyle to support thyroid function. Get enough sleep. Thyroid hormones follow a circadian rhythm, so proper rest helps regulate thyroid function. Manage stress. Chronic stress can weaken the thyroid and disrupt hormone balance. Practice relaxation techniques like yoga or meditation. Engage in light exercise. Activities like walking, swimming, or yoga improve circulation and help reduce cramps caused by hypothyroidism. Cramps might seem like a minor issue, but if left untreated, hypothyroidism can lead to serious complications. If you suspect thyroid dysfunction, get tested early and seek the right treatment. Cause 5, kidney failure and sodium imbalance. The silent culprit behind persistent cramps. The kidneys do more than just filter blood. They also regulate electrolytes, particularly sodium and potassium, which are essential for muscle function. When kidney function declines, the body struggles to maintain stable sodium levels, leading to muscle spasms and prolonged cramps, especially at night. Why does kidney failure cause cramps? When the kidneys are impaired, sodium levels may drop too low or rise too high, overstimulating the muscles and triggering involuntary contractions. Additionally, kidney failure disrupts the balance of potassium, magnesium, and calcium, all of which play crucial roles in muscle relaxation. Sodium deficiency causes sudden cramps, fatigue, dizziness, and low blood pressure. Excess sodium leads to water retention, swelling, high blood pressure, and intensified cramps due to muscle stiffness. Low potassium and magnesium results in muscle weakness and an increased risk of sudden spasms. Beyond cramps, kidney failure can manifest through a range of subtle symptoms that often go unnoticed, allowing the condition to progress silently to a dangerous stage. Warning signs of kidney failure you might overlook. If you experience one or more of the following symptoms, your kidney function may be compromised. Frequent muscle cramps, especially at night. Swelling in the legs, hands, or ankles due to fluid retention. Frequent nighttime urination, but with low urine output, chronic fatigue and weakness, foamy, dark-colored or unusually odorous urine, dry, itchy skin, and ammonia-like breath odor due to toxin buildup. If you notice two or more of these symptoms, consider getting your kidney function checked to prevent serious complications. Kidney protection strategies and cramps prevention. Reduce salt and processed foods. If your kidneys are already weakened, excessive salt intake can cause water retention, worsen swelling, and increase the risk of muscle cramps. Limit fast food, canned products, soy sauce, and high-sodium seasonings. Incorporate kidney-friendly foods. Leafy greens, spinach, cabbage help ease the kidney's workload. Flax seeds, walnuts, and olive oil contain anti-inflammatory compounds that protect kidney tissues. Low-potassium fruits, apples, pears, strawberries help maintain electrolyte balance. Maintain proper hydration. Drinking too little water can cause toxin buildup, while excessive intake can overload the kidneys. Your ideal water intake depends on your weight and health condition. Engage in light exercise to improve circulation. Activities like walking, yoga, and cycling can help enhance kidney filtration and reduce kidney-related cramps. Avoid overexertion, as intense workouts may put additional strain on your kidneys. Get regular kidney function tests. If you have a history of diabetes, high blood pressure, or kidney disease in your family, check your creatinine and eGFR glomerular filtration rate, DASH-IT, to monitor kidney health. Muscle cramps are not just a simple result of dehydration or electrolyte imbalance. Sometimes they can be early warning signs of an underlying health issue. This condition may be linked to nutrient deficiencies, circulatory disorders, nerve damage, or impaired organ function. Do you frequently experience any of these symptoms? Severe cramps at night that wake you up suddenly, tingling, numbness, or prolonged muscle spasms after light activity. Muscle weakness, making it difficult to perform normal movements, accompanied by fatigue, swelling, or unusual changes in urination. If you notice that cramps are becoming more frequent or occur alongside other unusual symptoms, don't ignore them. They could be signs of magnesium deficiency, peripheral neuropathy, hypothyroidism, or chronic kidney disease. Have you ever experienced this? Share your experience in the comments so others can learn from it. And don't forget to like and subscribe to stay updated with the best health tips.